Hello and welcome to the Megacast. Good day, Oakland County. I'm Tyler Keefe, joined by Erica Jones from Green Media Center on Walnut Lake Road in West Bloomfield. The studio offices of Civic Center TV, Comcast Channel 15, AT&T Channel 99, on the web in high definition, on CivicCenterTV.com, a service of the Greater West Bloomfield Cable Communications Commission. We're also joined by Birmingham Area Municipal Access. That's serving the cities of Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin. Comcast Channel 15 and AT&T Channel 99. On the radio, we're on 89.3 Lakes FM and live streaming on lakesfm.com. We're also joined by my high school alma mater station, 88.1 WBFH, The Biff, with leadership from station manager Ron Whittables, and WAHS 89.5 Avondale Community Radio, a service of the Avondale School District, Avondale Schools, with engineering from student Logan Pizzuro over at Avondale High School. Today, bringing you the latest news regarding the coronavirus in our community here in Oakland County and beyond. Plenty of news being made recently in the last 24 hours since we last spoke on the Megacast. And you can find that and other important information right here on our website, CivicCenterTV.com/coronavirus. This is the page, and this is how easy it is to get there. You go to CivicCenterTV.com. You see coronavirus right here at the top of the page. You click on it, and it gives you the latest news. We are updating this consistently. Our producer, Jeff, putting new stories up there daily and hourly as they come in to us here in Oakland County, giving you the latest news and access to information sources that you can trust, from federal resources at the Centers for Disease Control and Prevention, from the state of Michigan, and from Oakland County, as well as your hometown, and our list of cities and other municipalities below. Making news today, Governor Gretchen Whitmer yesterday in a 3 p.m. press conference extended the stay-at-home order, and manufacturing will reopen on Monday, as she announced. Those were the two biggest announcements that she made. The stay-at-home order extended through May 28th, which matches the state of emergency. Manufacturers, including major car companies, will reopen on May 11th. A quote from WDIV-TV's article on this, a quote from Governor Whitmer: we've really pushed the curve down dramatically, saved our health system, gathered personal protective equipment, and now we can safely begin phasing in sectors of our economy. There will be several safety restrictions and other checks that will have to be made at these manufacturing facilities as they reopen, but all of this part of a 6-phase plan from the governor's office as regards to how to properly and safely reopen the state of Michigan's economy. Currently, we are in phase 3 of the plan, which is known as the flattening phase. If you missed yesterday's press conference, it is on our website on CivicCenterTV.com. You can go there now, go there after the show, and make a bookmark of that tab. You can watch the full press conference, and you can watch highlights like this clip right here anytime on CivicCenterTV.com, and keep your latest information coming in. Other things making news on the coronavirus page on our website: Henry Ford performs the first post-COVID-19 transplant. This occurred on a 68-year-old mother of 3, grandmother of 8, and great-grandmother of 4. She received her new heart on April 25th and is expected to be discharged this weekend, right in time for Mother's Day. A wonderful story. Other stories making news at this hour: treatment and trials go on, but Michigan doctors are split on hydroxychloroquine. One of the largest clinical trials in the country is happening in southeastern Michigan to test the effectiveness of hydroxychloroquine against COVID-19. However, a 3,000-person Detroit trial reports are shedding doubt on the drug's effectiveness and safety. More of that on our online at CivicCenterTV.com/coronavirus. Other big news from Governor Whitmer's press conference on Thursday: Pfizer has begun a COVID-19 vaccine trial, and that vaccine is being manufactured right here in the state of Michigan. Pfizer and BioNTech announced that the first human trials are underway for a potential COVID-19 vaccine called BNT162. Trials were conducted in Germany last week. However, the vaccine is being manufactured in Kalamazoo, Michigan. Governor Whitmer announced the first dosing, treatments, and manufacturing of BNT162 in her press conference on Thursday. That, again, on our website at civiccentertv.com. Right on the homepage, you scroll down, you can get that full press conference and see everything that Governor Whitmer announced at her press conference yesterday. And as she has more of these press conferences throughout the week, we'll have those for you live. That's what's making news right now. We got other newsmakers coming on our show today. Plenty of people to talk to, including Nurse James Estabrook. He is a hospice nurse. Marcia Gershenson, Oakland County Commissioner from District 13. The new Chief Nursing Officer at Henry Ford West Bloomfield Hospital, that is Stefanie R. Newman. She'll be joining us in the first hour of the program. And then in the second hour of the program, Representative Cheryl Kennedy from Michigan's 48th District, the president of the Birmingham-Bloomfield Chamber of Commerce, Joe Bauman, and the director of communications at Cranbrook Academy of Art and their art museum, that is Julie Fracker. She will join us at the tail end of the program here on Civic Center TV, Birmingham Area Municipal Access, 89.3 Lakes FM, 88.1 WBFH, The Biff, and WAHS 89.5 Avondale Community Radio on the Oakland County Megacast. Live stream today via Facebook Live, courtesy of our friends at the Greater West Bloomfield Chamber of Commerce with Executive Director Suzanne Levine, also a Cable Commission member here in Greater West Bloomfield, a big supporter of Civic Center TV, of our operation, and allowing us to help spread the news that you need to know in your backyard throughout the community. We thank the Greater West Bloomfield Chamber of Commerce for helping us out with that today and helping us fulfill our mission. We mentioned all those other guests we're going to have on the show, and we'll get to our first guest in a moment. But first, good morning to you, Erica Jones, my co-host today. How are you, Erica?
I'm great. How are you? I'm so happy to be co-hosting today.
Yeah, it's first time we'll have you on the show, and it'll be good to get some insight. We can talk maybe a little bit later on. You just finished your semester at Miami University. You had a lot of that online, virtual learning, and we can maybe talk, if we have some time later on in the program, about what that entailed and what the challenges were with that. But before we get to any of that, we have our first guest on. He is with the Bloomfield Township Police Department. He is Captain Dan Edwards, joining us on the Megacast. Captain Edwards, good morning.
Good morning, Tyler. How are you?
I'm good. Captain Edwards, how are you? How's your team? How's your department holding up?
Our department is holding up good. We just, most of us went through the health screening that Oakland County had available to essential employees, and I'm proud to report that 0 of us have COVID right now, so we're healthy and safe.
Well, that's really good news. Any updates or information the community needs to know from our law enforcement, from our first responders, on local law enforcement as it stands at this moment?
Well, that's the reason I wanted to come on here today, is to let everybody know where we do stand with that. And our crimes reported this last week, I just pulled the stats, are down 50% for where they were this same week last year. So everybody is staying home and staying safe, and not even the criminals are not going out and committing a lot of crimes, which is really good for our community.
Yeah, that's always a positive. Less crime is always a good sign for our local law enforcement and for our community. You say a lot of people are staying home, so that's helping the crime rate stay down. As restrictions are being lifted, are you seeing more people out and about on golf courses, in the parks, walking on the sidewalks, and so on? Does that present any challenges, or has it so far, for local law enforcement and first responders?
Well, people are allowed, per the governor's orders, to go out and exercise, and they've been doing that. You got to maintain your mental health also through this whole thing. And we do respond to a lot of health and safety violations. People will call on their neighbors or on businesses that are open, reporting possible violations. And so we respond to all of those violations because we are the enforcement branch of the government. And so it's our job to go out and enforce the laws, even these new laws that the governor has put out. And the way that we enforce them, which is how we've done it right from the very beginning, we've told all of our officers that this is all new and we all have to learn together. And this is a healthcare crisis more so than a law enforcement crisis. And so our goals when we do this is to go out and educate the people, let them know what the laws are, and try to get voluntary compliance. And if necessary, we can document it on a report for review at a later time. But to this point, we have had to issue 0 citations for any health and safety violations, and we have not made any arrests, and everybody is willing to work together to keep us all safe.
For the most part, I mean, the weather's been getting a lot nicer now. So more people
Well,
are
I
going
would
to
disagree
want
with
to
you on that.
Not today.
I'm looking outside right now, and I'm seeing a little bit of snow.
Yeah, not today, but generally, yeah.
Yes.
Other than this beautiful snowy Friday we're having here in Michigan, the weather's been much nicer. More people have been getting out. How can they, from our first responders' perspective, what can our residents do as they're going back out to make sure they're going about that safely as they reemerge from their quarantine?
Well, obviously, social distancing is important, and wearing a face mask is important. And anytime you're in a public place, you have to wear a face mask. And we're getting a lot of calls for people that aren't complying with that. So we do go out and respond to that. And again, we try to educate them and try to get voluntary compliance, which, like I said, we've gotten 100% of cases to people to go along with what the governor's orders are. So when you're going out and enjoying this beautiful weather, just remember that, wear your mask and practice social distancing and follow the rules.
Yeah, always best to follow the rules, especially in these times. It's for people's safety, and it's for your safety, your families, and others as well. But for the most part, Captain Dan Edwards, Bloomfield Township Police Department, are you seeing people following these social distancing guidelines, wearing their masks out in public?
Yes, absolutely. And we've gotten, like I said, we get a lot of calls of complaints of neighbors having a big party or a big get together, or businesses that are open in violation of the rules. And we go and investigate them, and it may appear that way, but like birthday parties, there's a bunch of cars in my neighbor's yard and they're having a birthday party. Well, a lot of them are just a drive-by birthday party or a drive-by funeral. We've seen a lot of those. And people are practicing the social distancing, and so we haven't had any issues that we've had to issue citations to.
There's been news recently of increased use of technology, particularly cameras, to monitor social distancing and safety measures being followed. What are your thoughts on using technology to measure this, and how can it be useful for law enforcement to better understand how people are following these guidelines being set forth?
Well, I think this whole crisis is a healthcare crisis more so than a law enforcement crisis. And unfortunately, it's our job to enforce the laws, and along with that comes a certain reputation. But just educating people and getting voluntary compliance has worked completely. And most people want to do the right thing, and most people recognize that it's us having to work together as the enforcement branch and as them as people in the community. And so I think what the governor's puts out as the orders, they want to do the right thing and keep everybody safe.
So the use of this technology, these cameras, it's mostly been for monitoring crowd size. Are people social distancing? Are they wearing their masks? So as you said, it's been more about a health crisis and a health response, even from first responders and law enforcement, than it has been a law enforcement crisis necessarily. Are you saying in that case that these cameras and the use of extra technology to monitor these guidelines being followed is more for research purposes, so that law enforcement knows when they go out in the public, if they have a call, they know exactly what they're getting into?
Our officers are out there all the time, and they're driving around, and we've maintained our same level of staffing throughout this whole thing. Even though our reported crimes are way down, we're still out there and visible to the public and just to monitor what's going on. And anytime that we see issues, we would deal with them. And of course, cameras are an extra tool that we could use. Like I said, we haven't had any issues that we've had to enforce and issue citations for. So having cameras to monitor it is always a good idea. And we have cameras that we monitor things, and we try to always advance that. Getting other cameras like Detroit has, the green light districts that they have is using technology to aid law enforcement, and that's always a good thing. And it could be useful in this scenario also, but we haven't invested in that in regards to this crisis at all.
So for those residents of Bloomfield Township, of other municipalities that may be also using this kind of technology, can they be assured, they may be concerned about privacy, that maybe they're not wearing their mask in public and they're going to be tracked with facial recognition and then issued a citation. Is that going to happen, or are you, as you've alluded to in this, using that primarily for research purposes and understanding the community's reaction?
That is a great question. A lot of people, there's been a lot of rumors on social media and a lot of rumors that are out there because this is all new and it's scary. And like I said, our whole approach right from the very beginning, and I think that's a great point to bring up with facial recognition and law enforcement going after them, that we're approaching it from an education of voluntary compliance, and then if necessary to document it and review it later. We're not looking to use cameras to find people and then go out and arrest them. We want to work together with people, and we're not out to try to capture them with hidden cameras and stuff.
That's good to hear, and it's good to know also because it's a learning process for all of us. And we talked earlier this week with Deputy Police Chief Kurt Lawson from West Bloomfield about how his department and the fire department in West Bloomfield are really emphasizing education in the community at this time as people reemerge from their isolation or their quarantine, however you want to call it. What educational measures maybe is Bloomfield Township working on with the community organization to inform them of the safety measures that they can take and as they return to work, go out into recreation, go out in public, and so on?
Well, I think the media has been doing a good job on educating people of what the laws are. And I think you guys really do a good job of that. And we need to partner with you, which is why I'm happy to come on here today to talk to your viewers, to help you to educate the people as to what the laws are. And again, this is a healthcare crisis, and we're just one of the tools that is used to enforce the laws and to let people know. And we've been approaching it from an education standpoint, just like you said, Deputy Chief Kurt Lawson is doing from West Bloomfield. We're doing the exact same thing, educating, getting voluntary compliance.
Captain Dan Edwards joining us from the Bloomfield Township Police Department on the Megacast. Captain Edwards, before we let you go, just got another minute or so left. Anything else that you'd like to say, any other advice your department may want to give to the public?
Well, we're all in this together, and it's our job to enforce the laws, but it doesn't mean that we're going to go out and do it heavy-handedly. We are using discretion, and we are working with people, and we want to be in this with everybody. It's not us against them, like a lot of rumors that are out there on the internet would indicate. That's not at all true.
Captain Dan Edwards from the Bloomfield Township Police Department joining us on the Megacast on this Friday. Captain Edwards, thank you very much for being with us.
Thank you, Tyler, for giving me the opportunity to be on.
He is from the Bloomfield Township Police Department, Captain Dan Edwards, and a really informative interview, letting us know a little bit more insight into whether or not these newly issued pieces of technology, like cameras that have popped up this week in the news, are being used for tracking or being used for research. Good to know they're being used for research, because knowledge is power in this as it regards to law enforcement, as it regards to us learning how to enact these social distancing measures and these safety guidelines going forward. So good to hear from Captain Edwards that is the case. Joining us on the Megacast this morning on Civic Center TV, on BAMA, Birmingham Area Municipal Access, 89.3 Lakes FM and lakesfm.com, as well as our partnering radio stations from the Bloomfield Hills School District, 88.1 WBFH, The Biff, and WAHS 89.5 Avondale Community Radio. Joining us from Avondale Schools, our Megacast family of stations all throughout Oakland County. This is the Oakland County Megacast. We are going to take a short break, but when we return, we will be joined by James Estabrook. James Estabrook is a hospice nurse in the area. He will give us some insight into a nurse's life during the pandemic and how hospice care kind of varies maybe from what you would get in a hospital during this time. That and more coming up next on the Megacast on our family of stations. We will return very shortly with more.
Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
Hi, my name is Kurt Lawson, and I'm the Public Information Officer for West Bloomfield Township. We wanted to reach out to you, our older adults, to provide information that you may find useful during this difficult time. We want to ensure you that West Bloomfield Town Hall, our Waters and Utility Department, West Bloomfield Parks, and our police and fire departments continue to work hard on your behalf. Information and resources can be found on the Township website, the police Facebook and Twitter, or call West Bloomfield Park's COVID-19 Help Hotline. Please remember to keep your social distance of at least 6 feet, wear facial coverings when you leave your home, and wash your hands for at least 20 seconds with soap. These precautions will help keep you safe during these difficult times.
Returning to the Megacast, 89.3 Lakes FM, 88.1 WBFH, The Biff, WAHS, 89.5 Avondale Community Radio, and on television on Civic Center TV, Comcast Channel 15, AT&T Channel 99, as well as on Birmingham area municipal access, also Comcast Channel 15 and AT&T Channel 99. That in Birmingham, Bingham Farms, Beverly Hills, and Franklin. We're also joined on Facebook Live on the Facebook page of the Greater West Bloomfield Chamber of Commerce, joining us today on this Friday edition of the Megacast, and now joining us via Zoom. He is a nurse mostly in hospice care. His name is James Estabrook. James, welcome to the Megacast.
Hi, how are you today?
I'm good. How are you? How's your family? How are your colleagues?
Keeping my chin up, it makes a better target. We're doing well, keeping safe, staying home.
That's good to hear. It's National Nurses Appreciation Week, and I think it's safe to say we're all pretty proud of our frontline workers. We maybe haven't heard a lot of firsthand experiences from our nurses necessarily. How has this been for our nurses? What have been some of the challenges they've been facing?
So I think that primarily, especially as of recently, one of the biggest challenges is just misinformation that seems to be passed around. People thinking that a mask isn't helpful, different things that people have alluded to that just don't seem to show science backing it up. And you know, I know when it started, I used to be an ER nurse. I have a lot of friends that are in the ER. My wife is a resident physician starting up at the beginning of July in the ER. So the ERs and the ICUs, definitely places where nurses are just were, and probably still are, having a lot of hard times.
So for those that may feel that wearing a mask isn't effective, we see nurses and doctors wearing masks all the time when they're treating patients, particularly in surgery, but also in other general practicing measures. Why do nurses and doctors wear a mask, and how does that translate to our times right now, and why we need to wear masks out in public to prevent the spread of this deadly virus?
So in healthcare, you'll often hear people say PPE, personal protection equipment. These masks prevent transmission of any kind of droplet that would come from your mouth or your nose as you cough. Just breathing, we have vapors that come out of us that are able to transmit this. And so it's a matter of protecting yourself, protecting your patients, making sure everybody stays safe. When one of the first things in healthcare is keeping people safe.
So it is important because those who with this disease may be asymptomatic. They may not be showing signs that they're sick at all, and then it becomes even easier for them to pass that on to other people, which is why these masking measures are in place. So for you and your patients, what precautions with COVID-19 out there, and especially in hospice care, you're dealing with I would say maybe more elderly clientele most of the time. What precautions are you taking? What precautions do they have to take because they're a more vulnerable population in hospice?
Yeah, so I would say that my hands are probably the chappedest they've ever been. And I mean, I've always been really diligent to be washing my hands whenever providing care. I think that that's just increased tenfold for everyone. Washing your hands. When I get home, I'm dropping off the clothes that I was wearing when I was seeing people, making sure they're going directly to the laundry, jumping through the shower, because even your hair, a lot of the stuff that I've looked at, there's a lot of places that this can stay on you and be transferred. And yeah, I think that you brought up one of the most important points is that there are plenty of healthy people that are asymptomatic and walking around unaware that they're carrying this. It'd be like carrying a machine gun around, shooting people that was on your back. You didn't even realize it was there. And I think that that's the really big way to view this, that it's for the safety of your grandparents, your parents, your siblings. I say these things so that it might go deeper for people to realize that, this can affect your family. There's 60,000 people that have passed away right now that are just the confirmed cases. There's so many people that are passing away of other diseases, but COVID is a part of it. And the other disease is primarily, from my experience and coworkers and colleagues in the field, that are, the other disease is what's put down as the cause of death. So it's even the numbers are maybe not reflective of how invasive and bad this really is.
So you James Estabrook, a nurse at a local hospice facility. You may not have you seen a lot of COVID on the front lines in your area of nursing, and if not, have you heard any stories from other nurses, from other medical professionals that really take this home and explain just how dangerous COVID-19 is, and all the more reason in that case why we should be wearing our PPE and keeping our social distance?
I mean, the stories are heartbreaking. I know mothers who are living in their basement, not seeing their kids. I know fathers who are, doing the same, parents who are staying in hotels to protect their family so that they're not taking this home to them. People who have had to do things that they've never had to do, make video calls for patients to see their families as they're essentially leaving this life, and families that are just crushed by this, not being able to hold their hand. I know some people who work in ICUs where, they're having to be that person's family for that moment because their family's not there. And so there's a lot that we as healthcare professionals are doing in these times that we've never done in this way.
Local hospice nurse James Estabrook with us on the Megacast on our family of stations. It's Nurse Appreciation Week. There's been a lot of appreciation being shown recently for our first responders, for those on the front lines in hospitals and in other medical facilities. And with what we've been discussing in this interview today, I feel the need to ask, what can we do? Civilians like myself, like Erica Jones in the studio with me, my co-host today, what can we do right now and what can we do in the future to help our frontline workers?
Wash your hands, wear your mask. Don't make the trip to the store for one item. You know, when you're going to the store, bulk up, get everything that you could possibly need. Stay home and stay safe. You know, there's, at this point in time in history, we've got more entertainment available in our living rooms than ever before. You know, it's difficult. I'm an extrovert. So my wife will tease me. I'll go to Kroger and spend 2 hours in Kroger just walking around and saying hi to people and shopping. So even as somebody that is completely extroverted and finds my energy getting refilled from social interaction, I'm staying home. I'm not going to the store. So I would pray that everybody would do the same. There's so many people that are hurting and dying, and families that are losing loved ones. So stay home, stay safe, wear your mask, wash your hands, and your mask needs to cover both your nose and your mouth to be worn properly. So often I see the mask where it's, you know, the nose is completely open. That's not cutting it. Wearing gloves isn't as good as washing your hands. There's a class in nursing school that teaches you how to put gloves on and off so you're doing it properly. If you don't know how to do it properly, you're probably not doing anything good for you or others. It's easier to stick to the gloves than it is to your hands if you're washing them.
And so for those, just to follow up on that, for those that are wearing gloves, when is a good time for them to wear gloves? When is a good time for them to not wear gloves? And what are situations where they shouldn't be wearing gloves at all?
I think by and large, we're best off washing our hands. There's few situations, unless you're properly donning gloves and doffing them, putting them on in a technique where you're sliding it on and then you're only touching dirty items and then pulling them off so that you don't actually touch your hands afterwards. I see people walking around with gloves and they're touching all the things that they would touch normally. You're just contaminating everything. So really, I think all the evidence out there points to just wash your hands. Wash them 100 times more than you ever have. You're getting more bacteria, viruses, all that stuff off of your hands by washing them with soap and water. Water as warm as you can handle, doing it for the 26 seconds that's recommended. You know, scrubbing the backs of your wrists, in between your fingers, every area of your hands so that you're properly cleaning them. That's the best thing you can do.
Nurse James Estabrook with us on the Megacast. Anything else that we may not have touched on that you'd like to say just shortly before we let you go?
No, I just think that as healthcare providers that we appreciate all the appreciation that's being shown, and you know, as the most trusted professions over and over again through different polls that are taken, trust your healthcare professionals to tell you what's right. There's so much misinformation. I just want you to listen to doctors and nurses who spent their life dedicated to keeping people healthy.
Well, thank you, and thank your colleagues in hospice, in hospitals, and medical facilities all throughout on this Nurse Appreciation Week. James Estabrook, thank you very much for joining us.
Thanks for having me.
Nurse James Estabrook with us on the Megacast on Civic Center TV, Birmingham Area Municipal Access, 89.3 Lakes FM, lakesfm.com, 88.1 WBFH, The Biff, WAHS 89.5, Avondale Community Radio, and on the Facebook page of the Greater West Bloomfield Chamber of Commerce via Facebook Live. A really compelling interview there with James from a frontliner's perspective. And so, Erica, out in public, have you been seeing people following those guidelines, wearing their masks, wearing them properly? Are you wearing a mask when you're out in public?
You know, to some extent, it's crazy to see. Yesterday, after I left here, I went to CVS because I had to grab a couple things for my family, and a guy walks in front of me, no mask, no gloves, and for me and most other people, I'm like, well, I don't feel comfortable being in I mean, I guess I wouldn't be the one being affected, but that's just, I don't think people like that should be let in with no protection whatsoever. So, I mean, yeah, I am seeing a lot of people not following it, which is terrifying, honestly.
And all the more reason in that case to keep your social distance, to wear your own personal protective equipment so that you're keeping yourself safe, because not everyone's going to comply. And luckily with the stay-at-home order and the laws that are in place locally, that these businesses and these places of recreation do have the right that if you're not following those guidelines, that they can refuse service, so that they can ask you to leave. So it's all the more reason for us to continue to follow those guidelines as best as we absolutely possibly can and help each other, because in doing so, that's the best way that you can show your appreciation for those on the front lines.
Yeah.
And that's what we're going to have to do. We're going to have to keep doing that, wearing your mask out in public, keep it at least 6 feet distance. Here in the studio, we do our best to keep 6 foot distance. These cameras kind of compress things a little bit, so it definitely is 6 feet in here. We assure you of that. We're cleaning this place regularly. We're wearing our masks out in public places, and we encourage you to do the same, as do our healthcare professionals and our people in government leading us through this crisis, including leaders like Oakland County Commissioner from District 13, Marcia Gershenson, joining us now on the Megacast. Commissioner Gershenson, welcome.
Thank you. Good morning.
Yeah, good morning. How are you? How's your family? How are your colleagues on the board?
My husband and I are totally isolating. We are both at risk. We're both in the at-risk group, and we are washing our hands a lot. I thought that was a great interview. I think it would be important for people to Google how to properly put on gloves, because I think I may be doing it incorrectly. So a lot of good information was shared.
And maybe some information that they can get from Oakland County, from their local healthcare professionals, such as, of course, Dr. Russell Faust from Oakland County has been great getting information out to us and others. Maybe next week we'll talk to a local doctor. We can talk to Dr. Jamie Tawil or somebody else about the proper way to put those gloves on, the proper situations to wear gloves, and how to wear those PPE correctly.
Right. And also maybe about how to bring groceries in your house. I know there's lots of confusion about how much do you wash, how do you deal with fresh produce. So I think that would be a great topic to cover too.
And it absolutely is. There's so much going on. There's so much change happening in our society. We just got to we have to adjust to that. And that's happening on the medical side. It's happening on the personal side, and it's also happening in Oakland County and throughout the state and the country on the financial side as well. So moving into some of the county operations, there's some new funding that was recently announced and recently rolled out by the county for small businesses.
$219 million.
Yeah, yes, no small amount.
Hands around that figure, but I just want to say, do you know that our county exec Dave Coulter is doing daily updates at 1:30 for residents? And also we've got an incredible dashboard at oakgov.com that's tracking a lot of the data, and also has instructions for small business owners and people that are looking to get unemployment. I've been getting lots of calls from people who are frustrated with the unemployment connections, and that it is taking long, but they are responding, and almost everyone I've worked with after a few weeks does get their checks or their response. So I would really encourage people to stay patient. It's just such an unprecedented tough time.
It is, and with those financial hits that are coming in for our small businesses in Oakland County, there are so many. There's the mom and pop shops, there's the restaurants all throughout this community. There's other small businesses in a variety of industries, and that's why more of this money was rolled out after the initial rollout earlier on in the process. How in need, from your knowledge and your communication, has our local business community been due to these COVID-19 related losses?
Well, before we received the federal funding, the Board of Commissioners with the county executive were offering small business loans and grants and money for businesses that could transfer over their business, their manufacturing into making personal protection items. So as on the board, we were allocating millions of dollars to our local community. So we put all that out and we had an incredible response. More businesses needed money than what we had allocated. Now with the 219 million, we're going to be reopening those loans and grant opportunities, as well as businesses that can change over their focus to personal protection items. So all that will be coming up soon.
So there's plenty of relief programs and programs for these small businesses from Oakland County and also from the state and federal government as well, but right here locally that's supporting these local businesses. I have to ask also on that note, we've talked this week with Superintendent Ken Gutman yesterday from the Walled Lake School District. We've talked previously in the week with Dr. Jerry Hill from the West Bloomfield School District, and it's looking like with the upcoming budget year in Michigan, education funding is going to be drastically reduced. Is there anything that Oakland County has in the works, or it maybe is discussing about providing some aid to our exceptional local schools?
Right. I mean, we have an extremely talented administrator in Wanda Cook Robinson that oversees Oakland Intermediate Schools, and we work hand in hand with her. So we're definitely keeping our eye on that. It's one of our most important priorities are our kids and trying to work out this education stoppage. Although so many teachers are working online virtually, such long hours. I'm a former school teacher, and it is difficult to teach online. Not only is it putting a tremendous strain on the teachers, but the parents that are dealing with this. This is really unprecedented. So we are really trying to stay on top of it, and we'll be interested in providing resources to help our schools.
Lastly, regarding to education, you being a former school teacher yourself, Marcia Gershenson, Oakland County Board of Commissioners from District 13. With all the innovation we're seeing from our local businesses, our restaurants, these stores that are changing the way that they do business to stay alive, innovation is often bred from knowledge and education. And with what we're seeing our schools potentially going through, can you just explain how important is it for the future of our county that we continue to emphasize education as we have?
Well, we have a commitment from our governor. We have a commitment from our county exec to raise our numbers of students that are going to college or are participating in apprenticeships. We're really focused on Michigan Works and working with them to increase the number of apprenticeships and job trainings. It's not all about a four-year college education. It's about getting trained in trades, and so we are very focused on spreading opportunities around that will give more options for students.
And there is so much opportunity beyond programs that require four-year degrees in industries that require degrees that are all throughout Oakland County and throughout southeastern Michigan. So that's great to hear. Moving on, another hot button issue. We've been talking so much about funding for education, funding for small businesses. That's often a lot of that money, a lot of those dollars are coming in as a result of data from the U.S. Census. So Marcia Gershenson from the 13th District in Oakland County, how does the census data What does the census data do to affect municipal funding and county funding?
Well, I really think there's a disconnect between with people's understanding of how important completing the census is. Yes, they get a count of population, and that's critical because they use that data to decide how many congressional delegates we get in Washington. So if we don't get a good response, we're in danger of losing one of our seats. And those seats are so important because of the work the Congress people do in bringing funding and programs back to Michigan. But I think what people don't understand is that money that is allocated to our state based on the response goes to police and fire, goes to schools, goes to fix roads, works on affordable housing, works on Medicaid. There are so many things that money helps with. So right now, I am very proud to say that Oakland County has a 70% return rate, which is higher than the state's rate. So I think we are getting the message out, but it's just critical if you haven't either returned the questionnaire by mail, you haven't done it online, or you haven't received a phone call, to reach out to one of the census workers, and you can get all that data on Census 2020 if you go online. And certainly if anyone is having any trouble, I can be contacted to help them get their application. And my information is public. My contact information is available. So I think people have to realize that for every person that does not respond, our state loses $1,800 a year. That translates over 10 years, because the census is done every 10 years, into $18,000. And I think this year we are expected to receive $30 billion, that's a B, $30 billion. And as I said, that money goes to the schools for tutoring and books, for all kinds of local services. So my message to people today is, if you haven't responded, contact any of your elected officials or go to Census 2020 and find out how you can participate.
Lastly, this also impacts funding that would go toward emergency situations. And I think that hits a little closer to home right now. So for those that may be reluctant or just don't want to take the time, don't think they have the time to fill out the census, explain just how critical it can be, not necessarily in this emergency because we're coming out of the last census data implications, but in the next emergency that we don't see down the road. What can this census data do to help Oakland County and its municipalities respond?
Well, one of the great things the census does do is it lets us know where populations are. And that information is critical when we're looking at hospitals that want to open, or we're looking to set up new facilities. One of the things we're committed to doing in Oakland County, somewhat as a result of this pandemic, is we're going to strengthen our Oakland County Health Department. We're going to be doing partnerships and collaborations with other existing hospitals and healthcare organizations like Honor Health. And we're going to make healthcare more accessible. So we need to know where those populations are, and businesses use it, real estate developers use it. It's critical information to know where your population is, so we can focus on giving more money to roads, and also to know the demographics of seniors. You know, Michigan has and is scheduled to have more seniors in our state than in the state of Florida, which is traditionally known as a senior haven. So we are working hard with our senior agencies to be sure we have enough resources to have seniors be able to stay at home, live independently, and strengthen our seniors' options.
Marcia Gershenson, Oakland County Commissioner from District 13. Thank you very much for joining us on the Megacast.
Thank you for having me. I look forward to staying in touch.
Absolutely. We will make sure that happens. Marcia Gershenson joining us from the Oakland County Board of Commissioners, District 13, on the Megacast on Civic Center TV, Birmingham area municipal access throughout our coverage area. Those two TV channels, West Bloomfield, Keego Harbor, Sylvan Lake, Orchard Lake, Birmingham, Beverly Hills, Bingham Farms, and the village of Franklin. Our partnering radio stations are flagship, of course, 89.3 WBLD, 89.3 Lakes FM, 88.1 WBFH, the BIF, a service of the Bloomfield Hills School District, and WAHS, 89.5 Avondale Community Radio, a service of Avondale Schools. And we're also partnering today, our Facebook partner, the Greater West Bloomfield Chamber of Commerce via Facebook Live. We are absolutely thrilled to be on with them once again today, helping to spread the news to you as we've been doing so far on this show. We're just coming up on the top of the hour, and before we get to the top of the hour, we're going to speak with the Chief Nursing Officer from Henry Ford West Bloomfield Hospital. She is joining us now on the Megacast. She is Stefanie R. Newman. Stefanie, welcome to the Megacast.
Thank you.
How are you? How's your team?
You know, we are doing very well. We seem to be coming out of all of the pandemic high peak time. So we are doing fantastic now. A lot of our patients are doing well, so we're happy. It's Nurses Week. We couldn't ask for a better time.
That it is, and thank you. And thank your nurses for all that they're doing right now and that they were doing before and what they will be doing in the future to keep our communities safe and our people healthy as much as possible. From what I've heard from my producers, you just started this position at Henry Ford West Bloomfield Hospital as their Chief Nursing Officer. What a time to start! It's been quite a trial by fire, I'd imagine.
Yes, it's. I told and teased everyone here that normally when I start a new position, we have record-breaking snowfall wherever I've been, and I come here and I have COVID. So it's been quite an interesting time for me. But instead of taking 3 to 6 months to get to know people here at West Bloomfield, it's taken me about a week to get to know people, but it's been a trying time, but it's when nurses really excel at what they do. Nurses and physicians, the whole team did a fantastic job through this pandemic at our most vulnerable time.
So what are some of the new challenges with COVID and as the COVID-19 crisis hopefully starts to wind to an end? What are some of those new challenges that your nurses are facing during this time?
Well, one of the things that we are working on right now is how to phase some services back in, using our volunteers, having visitors come back whenever the governor lifts her order, and also phasing surgeries and ED visits that are non-COVID related back into our business every day.
More people than ever are being discharged from hospitals right now that had COVID-19, and as you said, it's going to mean more of these other procedures will start to reemerge at the hospital. More of the elective and at least the non-timely, the elective, the non-timely, and the timely procedures that were delayed during this process. But COVID-19 has presented its own challenges, and with these non-COVID patients coming back in the near future and beginning to be treated more often than has happened during this crisis, what does your team do in that case to keep your COVID patients safe continuously, and also with this virus still out there and there not being a vaccine, keeping these new patients that will be coming in also safe during this process?
Yeah, well, the whole team has been working on, before it seemed as soon as COVID got started, we started looking at how we're going to phase things in and keep other patients safe, because we did have other patients with other illnesses come in during that time. We, and all emergency departments, I would imagine, but definitely the Henry Ford Health System emergency departments do still keep all of our patients separated who have COVID symptoms. We keep them separated from patients who may not have COVID symptoms that are coming in for diabetes symptoms, for high blood pressure, common cold type symptoms. So we keep our emergency departments separated for those patients. We screen every person that comes into the building. We're still not allowing visitors right now, but we do screen everyone that comes into the building. So that really helps us.
Stefanie R. Newman, Chief Nursing Officer at Henry Ford West Bloomfield Hospital, on with us on the Megacast. There's been a lot of struggle throughout the pandemic to maintain PPE stocks in the hospitals. Did this shortage hit Henry Ford, and how did your team work through it, if it did?
You know, we got very close to being at critical shortage levels, but we also were able to implement some conservation measures. So we never really did run out. We may have had to use different products that we were not, different brands of PPE that we were not accustomed to. But gowns for the staff, gowns are gowns as long as they are able to take care of their patients and they feel safe wearing the PPE. So while a lot of places did experience shortages that were critical enough to cause concern, our staff within Henry Ford Health System were always, they always had PPE available to them.
It's reported that the stockpile now of PPE in hospitals is higher than it's been at any time during this process. Is that the case at Henry Ford, or is it at normal capacity at this time?
Right now, we have quite a bit. I think it is probably our normal capacity right now. We haven't experienced any overages because, of course, we're, the whole country is having to kind of restock, for lack of a better word. But again, we haven't experienced any issues with our nurses having PPE, which is great.
That is great. We've talked a lot recently also about the mental health implications of COVID-19 for civilians, particularly our senior population. How have your nurses, how have the medical professionals at Henry Ford been holding up during this? And what are some of the ways that your team works to work through this from the mental health side and keep each other in as best spirits as possible?
Yeah, we have our employee assistance program to help a lot of our staff. We have a wonderful chaplain here who went above and beyond what his job description is to make sure our staff were safe, and they had someone to talk to other than themselves and us, because it was a pretty traumatic experience for us. But a lot of resources that Henry Ford Health System have made available to us, and they continue to make available to us. We're also developing a plan as a system for wellness and to be able to help each other and lean on each other. So I look forward to that coming out as we wind down, or we seem to have declining patients coming in from an inpatient perspective of COVID patients.
We talked earlier on the program today with another nurse James Estabrook. He works in a hospice facility, and I asked him this question. I think it'll be good to get a perspective from the hospital side as well. With this being Nurse Appreciation Week, and with us talking so much about showing our appreciation for the frontline workers, for first responders, what can we do as civilians right now and as we go into the future in this process and beyond to help those on the front lines maintain safety and just to help them do their jobs as effectively as possible and as safely as possible?
Well, what I will tell you is that the community has been fantastic to us here at West Bloomfield Hospital. There were a few times when things were pretty misty for me, when you walk out and you see all the thank you signs and people, we had a parade of sorts from the community, and then our first responders on the outside of the facility. So that was actually fantastic. The community has shown us so much love. I think the one thing that we ask of the community is that you all please do stay inside. Please adhere to the governor's stay-at-home orders so that you can stay safe and stay healthy. It is the best thing that you can do for us as healthcare providers.
Chief Nursing Officer Stefanie R. Newman from Henry Ford West Bloomfield Hospital joining us on the Megacast. Stefanie, before I let you go, anything else that you'd like to say, anything else that maybe we haven't touched on you think would be important for our audience to know?
Yes. While we're saying that, we want you to stay in as much as possible to stay healthy, for those people who have chronic illnesses or experiencing illnesses, our emergency departments are open, and we would encourage you, if you're not feeling well and it is not something normal that you feel you can take care of at home, know that our EDs are safe, our physician offices are safe. We're taking extra precautions to ensure your safety. Please do not stay at home when you're ill. I would also like to say that May is National Stroke Awareness Month. So if anyone is experiencing symptoms around weakness in the face, arms, and legs, slurred speech, loss of vision, inability to walk, please dial 911 and get to an emergency department as soon as possible.
Okay. Chief Nursing Officer Stefanie R. Newman from Henry Ford West Bloomfield Hospital, thank you very much for joining us today on the Megacast.
Thank you. Have a good day.
You as well. Stefanie R. Newman, the Chief Nursing Officer from Henry Ford West Bloomfield Hospital, joining us on the Megacast on our family of stations. On the radio, 89.3 WBLD, Orchard Lake, West Bloomfield, Keego Harbor, Sylvan Lake. On 88.1 WBFH, Bloomfield Hills, 88.1 The Biff, and on 89.5 WAHS, Auburn Hills, WAHS 89.5 Avondale Community Radio. And as well as on TV, on Civic Center TV, Comcast Channel 15 and AT&T Channel 99 in West Bloomfield, Keego Harbor, Orchard Lake, and Sylvan Lake. And on Birmingham area Municipal Access TV on Comcast 15 and AT&T Channel 99 in Birmingham, Bingham Farms, Beverly Hills, and Franklin, as well as on the Facebook page of the Greater West Bloomfield Chamber of Commerce, joining us today via Facebook Live for the entirety of our program. We thank them, of course, for helping us spread the good word via Facebook Live today on this Oakland County Megacast program of ours. We will return in just a moment after this short break, and when we come back, we will be joined by another special guest of ours, State Representative Cheryl Kennedy from the 48th District. Here on the Megacast, we will be back very shortly.
Hi, I'm Dr. Faust, the Medical Director for the Oakland County Health Division. The most important thing you can do to prevent the spread of illness is to wash your hands thoroughly and often. Follow these 6 easy steps every time you wash your hands. Step 1, turn on the sink and wet your hands with warm water. Step 2, apply soap to your hands and lather between your fingers, under your nails, and the front and back of your hands and wrists. Step 3, wash your hands by scrubbing them together for at least 20 seconds. Step 4, rinse your hands with warm, clean water. And step 5, dry your hands with a clean cloth towel, a paper towel, or hot air blow dryer. If you're using a cloth towel, make sure to change it often. For handheld faucets, turn off the water using a paper towel instead of your bare hand. Step 6, if you're using a paper towel, throw it away. Practice healthy habits like washing your hands after coughing or sneezing into them to keep you and others healthy. Go to oakgov.com/health or call Nurse on Call at 1-800-848-5533 to learn more.
Coronavirus is deadly, but Michigan can fight back. Our front doors are the front lines of defense. Staying home is the best way to stop the spread, because just one infected person can give it to 40, who can give it to countless more. So call Grandma, don't visit. Video chat, don't meet up. And if you must go out for food or medicine, keep at least 6 feet from others. Stay home, stay safe, stop the spread.
The Oakland County Megacast, Civic Center TV, and Birmingham area municipal access television. Online in HD on civiccentertv.com, on the radio on our family of stations, 89.3 Lakes FM, 88.1 WBFH, The Biff, under the guidance of station manager Ron Whittables and his talented group of students, and over at WAHS 89.5, Avondale Community Radio. Our student engineer from Avondale Community Radio, Logan Pizzuro, doing a great job with us all throughout this process. He's been with us since the very beginning, getting up every morning. He's a high school student, getting up every morning, getting texts from our team at 8:30, at 9 o'clock, running this show 10 a.m. to 12 noon, listening and watching the news with us all morning. What other high school student is doing that every single day right now, getting up early on their own time? It's great. We have great community partners at these high school radio stations, and listening to them as I drive around Oakland County, it's good to know the state of high school radio in Michigan is really strong, and they're fulfilling their duties as community radio stations as well. It's a learning experience for these students, but it's also a great community tool and community service that these other stations are providing. We thank them for their partnership. We also thank the Greater West Bloomfield Chamber of Commerce for their partnership today, joining us via Facebook Live, allowing us to stream the entirety of our program today on their Facebook page and have us have conversations with all of our guests on their Facebook Live, including our next guest, State Representative Cheryl Kennedy from the 48th District of Michigan. Representative Kennedy, thank you for joining us.
Happy to be here. Thanks for inviting me.
Well, thank you for coming on. How are you? How is your family holding up?
Yeah, we're good. Everybody has stayed healthy, and that's all anybody can ask for right now. So we're just hanging out, trying to stay away from the germs.
Well, that's good to hear.
Like everyone else.
Yeah, it's good to hear. Absolutely. How about District 48? How's District 48 doing?
Well, District 48 is a pretty pragmatic district, and my staff and I have made over 1,000 calls in the last few weeks just checking in on people. And overwhelmingly, people are doing exactly what they're supposed to do. They're staying home, they're staying safe. We've got some workers that are going back to work. We have a lot of construction folks in my district, and they're happy to be going back to work, but also equally concerned about making sure that there are protocols in place when they go back to work. I've got a lot of GM employees that will be going back to work soon. The factories are going to be reopening soon, and I know the governor has been working closely with labor to make sure that those, and OSHA, to make sure we have healthy protocols in place there. So there's that push-pull of I'm really ready to get back to a little bit more of a normal life, but also the uncertainty of what that means. And so I think overall the 48th district, we were on a really steep curve going into this, very similar to Detroit and Michigan, and folks have done what they're supposed to do, and we're in much better shape now.
It's been a tumultuous time in Lansing of late. Were you at the Capitol during the recent protests, and what was that experience like for you?
Yeah, I sure was, and it was really interesting. Before I was a legislator, I was actually a principal in Walled Lake, and before that I was an assistant principal in Birmingham. So I'm very familiar with the area, and as a principal, we do active shooter training drills. We make our 6 and 7-year-olds go through that, and those are really scary. But I've never been in the position where I actually had armed people on the other side of the door who were, people call it protesters. I feel more on the line of terrorism, to be perfectly honest. Not to say there weren't protesters there that were there for the right reasons and had absolutely a right to share their views and their concerns. And honestly, when I met people on the lawn, they were very polite. But once that, and a lot of these folks that were there with the guns were from out of state. They were paid to be there. They were paid to cause chaos and fear. And that's what, that's what the definition of terrorism is. And so I don't put everybody who was at that rally in the same category, but the folks who were there and not really with a message, just their message was, anti-government and take over government, and using, the armed militia movement to say that. It was frightening. And just recently I had a call that since that day, my hope was, all right, they were there, they kind of got it out of their system, the bills they were promoting passed. But my understanding is that since that day, it just made those bad actors even more empowered, and that they, are continuing to make real threats against our state capitol and our legislators and our government employees. So it was a scary day, and it continues to be a frightening time.
Did you feel safe that day at the Capitol to be in person and to be voting at? And with COVID-19 going on, on that note also, do you feel safe going to the Capitol and voting in person?
The Capitol's done everything they can to put protocols in place so that we touch as few things as possible. We're spaced out. I don't sit at my desk. I actually have an assigned seat in the gallery so that we remain spaced apart. Most of the members wear masks. I wear a mask and gloves. There are some members that don't. I wish they did, especially in light of the fact we've already lost a member to COVID. If nothing else, in his memory, wear a mask, and remember, the mask isn't to protect you, it's to protect the other person. So to me, it's just kind of an unselfish thing to do, to wear a mask. But I think that they've done everything they can to keep it as safe as they can. And of course, as long as you're interacting with people, there is no 100% safety. So I would prefer that we would pass legislation that's been introduced, that we could do our legislative duties remotely. I think that would make a lot of sense at this time. But having said that, I'll do what I have to do because I was elected to be the voice of my district, and I will make sure that voice is heard.
Do you believe that the actions that Governor Whitmer has been taking throughout this process have been the right moves? Do you believe that it's within her power to make the decisions that she has made?
Yes, and my district doesn't include Flint, but we are adjacent to Flint. So, and I go to church in Flint. And so if you look back at, for example, Rick Snyder, when he was governor, he used these exact same powers for close to I know it was more than 100 days. I know it's closer to 200 days without issue, because a state of emergency lasts as long as the state of emergency lasts. That's been something that a number of governors have used in the past. It's a law that goes back all the way to 1946. It has never been challenged. And so absolutely she has the right to use her executive powers when we are in a state of emergency. When we fail to be in a state of emergency, then of course those emergency powers would not be appropriate. Having said that, I think it's also appropriate that legislature has oversight of how that money is being spent, and that our tax dollars are being used appropriately, and that the government is working for the people. So there's certainly, and there's plenty of legislation to be had. We're going to have to adjust our budget that we had already passed for this year because we won't have the revenues. We have to, we're still in the budget process for next year. And we have a number of COVID legislation that needs to be passed to make sure that our citizens are protected. So the legislature still has a huge role to play in this, but that doesn't mean that the governor doesn't have her full authority to use executive powers when we're in a state of emergency.
As far as the lawsuits go regarding Governor Whitmer's use of power, what are your feelings on those recent lawsuits? Can you touch on that a little bit?
Well, I think that's been part of the plan. And one of the things you hear the governor say quite a bit is, this isn't a political issue. This is a health issue. And the leadership of our House and Senate, unfortunately, right now, rather than being participants in that and participating under with the executive authority that the governor has, and having conversations with her to make sure that their input is heard, have decided that they're going to make this a political issue. So the plan has, I believe, has always been that they would pass legislation that they knew didn't have a leg to stand on as far as legally, and then when the governor would veto it, they would create a lawsuit. This just keeps that negative conversation in the headlines longer, and it doesn't really help us get to where we need to be, which is in post-COVID world where people are working in a safe environment, where we're making sure that people have access to healthcare and testing, and we're getting resources that our first responders need and our nurses need. To me, it's a distraction, and I don't think it's the right path. But I'm not surprised. It's very similar to the path they took when we were negotiating a budget last year.
Going forward, what challenges State Representative Cheryl Kennedy from the 48th District in the Michigan House of Representatives, what challenges does the state face as it begins to open?
Well, you know, my background is in education, and I tend to focus my legislative work in the world of education. Having, as I said, I was principal of Geisler Middle School in Walled Lake for 6 years, and before that I was the assistant principal at Derby and Berkshire and Birmingham, and I'm also on the appropriations committee. So my focuses tend to be around state budget and specifically education. So I'll speak to that although we are going to get some CARES Act dollars to the state of Michigan, those CARES Act dollars won't begin to fill the lack of revenue that we have not been able to collect, because our revenue primarily comes from sales tax, and people haven't been buying things like cars and boats and homes, and we haven't been going out for dinners and all those things that we normally raise a lot of sales tax. So we're going to be in a revenue shortfall. In education, we're looking at a shortfall over the course of both of 2 years, this budget and next year's budget, probably between $3 and $7 billion. And what that looks like in the world of education is between $600 and $800 per pupil that will be short. And so if, you know, in the 48th district, our schools don't get as much as they do in Oakland County, but in my district, a typical school gets about $8,000 per pupil. And so if you cut, you know, 10% of that, that's a lot. And that's going to really affect what we can do in public education. And then when you add on top of that because special education is a civil right, and students who have not been able to receive their special education services, those services still need to be provided. That's going to be additional cost. Already, special education costs are underfunded in Michigan, and so in good times, the first $500 of per pupil spending goes toward special education. And so if you take that, you know, say $8,000 and then subtract $700 because of the COVID crisis, and then subtract the $500 that we normally goes to the additional cost of special education, and then additional special education costs on top of that because we have to provide additional services, we're really looking at a dire situation for public schools. And I'll say that local governments are in exactly the same shape. Local governments get their money from tax dollars, and we just haven't been raising that revenue. So unless the federal government comes forward with additional CARES Act money specifically for local governments and schools, we're going to have to make some really unfortunate choices. And I'm hoping that once we feel confident to get back into a normal life again, that people are spending money again and those revenues will come back. But for the next, we can see this affecting our state for the next 2 years and in a big way.
So with education being as critical as it is for innovation in business and in the medical field, and just keeping our state on a forward path in a greater trajectory, we spoke earlier on this week with Kenneth Gutman, the current superintendent in the Walled Lake School District, where you were once a principal at Geisler Middle School, and he said that that Walled Lake was just at the point this year where they were reaching a point of recovery from where they were at financially. in 2008, and they, with the upcoming crisis, could go right back to that point in the coming year and the coming years. What are you and your colleagues on both sides of the aisle working on in order to ensure that our education system, which has been thriving of late, doesn't have a major setback because of the financial hits of COVID-19?
Right. Well, one of the things that I'm doing, for example, is I'm meeting with our congressional delegation at the federal level in the next few weeks to talk about the need to make sure that we're pushing extra dollars into special education. If we could just fund our special education costs at the 40% level that they're supposed to be funded from the federal government and yet never have been, if we could just do what we've been supposed to be doing, that would go a long way to providing those funds, to having enough money to keep things going in a pretty neutral direction in education. And one thing that I've learned since being in the legislature and also most recently is that the federal government finds the money to fund what they prioritize. And so it's really up to us as citizens to be reaching out to our Congress people and saying, look, we need your help. We need you to come up with some extra money for education. Because in the state budget, we have to balance the budget. We can't just say, oh, we're going to borrow some money from China and not balance our budget. We have to balance our budget. We can't spend dollars we don't have, and we simply don't have these dollars because of the COVID crisis. And I'm concerned. We have a lot of schools that are close to that 5% fund balance, which creates a trigger, and then the state comes in and kind of takes over. We don't want the state making those decisions for school districts. School districts should be able to make those decisions, but I fear that just as Mr. Gutman was saying, schools were just starting to crawl out of that because our governors, we have been giving more money to schools last year, and we were anticipating doing that again this year until the COVID crisis hit. So we have a lot of schools that are very close to that 5% demarcation, and we know that the state isn't the right person to make those decisions, and that's exactly what happened. So I'm working with legislators too to see if we can't come up with a solution for that short-term scenario. And then the other thing is the governor supported a weighted model, and I think now more than ever we really need to look at that weighted model. And I've been talking to our education appropriations chair about that. Knowing that we are going to have limited resources, we really need to make sure those resources get to the kids that in the districts that need them most. So sending more money to schools with larger transportation costs, larger levels of poverty, larger levels of special education, larger ESL populations, those are all things that I think we need to be looking carefully at, and we are.
Representative Cheryl Kennedy from the Michigan House of Representatives, representing the 48th District of the state of Michigan. There's been so much tension in Lansing. There's so much that people are working on both sides of the aisle and all three branches of our government, and there's a lot of fighting going on right now. So, Representative Kennedy, just before we have just a couple more minutes with you before I let you go. What do you have to say to your colleagues in your caucus and the other caucus as well, on all three branches of the government? What do you have to say about what you can do as the leaders of Michigan, what you should be doing as the leaders of Michigan right now to do what's best for the people going forward?
Well, I'll tell you that a lot of the fighting that gets in the headlines is really at the leadership level and between the leaders of the House and the Senate and the governor. And when you talk to individual representatives, we've got great relationships across the aisle. I have so many awesome partners on the other side of the aisle that I trust, and they trust me, and we really try to solve problems and do our best for the people of Michigan. And then we think we've got a great solution, and then it turns political. So if we could just take, a few steps back and realize that when we make this a political argument, nobody wins. There are no winners in a political argument. This is something that we just need to all be on the same bus, moving in the same direction with the same vision. And that is to do what is necessary in this very unique, difficult time so that we can land on our feet on the other side of this crisis. And that will go in a much smoother direction if we can all be working together. So the good news is that at the representative level, we are working together. We're talking, we're problem solving, we're listening to stakeholders, we're sharing information, we're sharing stakeholder concerns. But unfortunately, once we get to a level of leadership, it can become more political, especially when we're facing an election in November. So if we could just take a few steps away from that and remember that we're all on the same bus, and that's working for the people in Michigan, I think we'd get a lot farther.
Representative Cheryl Kennedy from Michigan's 48th District, thank you very much for joining us. Anything else you'd like to say before you go?
I just really appreciate this opportunity, and I want to give a big shout out to our medical professionals and our essential workers for just being on the front lines. And I just can't say thank you enough to those folks for realizing that they're putting their lives at risk, and yet their jobs are so important to keep the rest of us safe. So thank you so much for everybody for all you're doing, and thanks for inviting me to this program.
They absolutely are. Thank you very much for joining us. Representative Cheryl Kennedy from the 48th District of the state of Michigan, House of Representatives, with us on the Megacast. Civic Center TV, Comcast Channel 15, AT&T Channel 99. Same deal in Birmingham, Bingham Farms, Beverly Hills, and Franklin, with Birmingham Area Municipal Access Television, Comcast Channel 15. And if you go on AT&T, you click over to Channel 99. You can get all of our partnering TV stations through their public education and public access television guide. We're also on the radio, 89.3 Lakes FM in the greater West Bloomfield area. In Bloomfield Hills and the surrounding area, 88.1 WBFH, The Biff. And in the Auburn Hills and Pontiac area, WAHS, 89.5 Avondale Community Radio, joining us on the Megacast family of stations as we bring you the latest information from Oakland County during this crisis and talk to people throughout the community to get a whole different perspective you're not getting anywhere else. You're not going to get this on the 6 o'clock news, the 8 o'clock news, CNN, Fox News, MSNBC. You're not getting this anywhere else. This is in your backyard. These are people that are your neighbors, that are your friends, that are your family, that are your business owner across the street, down the street, and around the corner, that are telling you the stories of our community during this trying time that we're all dealing with. And we'll have more guests coming up, just a couple more people to talk to before we wrap it up this week. And we'll be back in just a moment with more from the Megacast on our family of stations. Stay tuned.
Technology like smartphones are wonderful devices to reduce social isolation in older adults. You can call grandchildren, phone friends, participate in fitness classes, and play games. But you need to stay mindful of scams. Scams related to the COVID-19 virus are rising. These include attempts to obtain personal information from seniors, including pitching unreliable products, advice, tests, and cures. You need to stay vigilant and be cautious. If you feel that you have been taken advantage of, it's okay for you to reach out to somebody you know and seek out advice, or even contact your medical provider. Thank you.
Hi, I'm Oakland County Executive Dave Coulter. Our top priority remains slowing the spread of COVID-19 in our communities. Please stay home, and when you must go out to an essential business, take precautions like social distancing and washing your hands when you come home. Because of the pandemic, we are behind in our response rate in Michigan. While you are home, please take a few minutes to fill out the census. It is more important than ever that we receive money back from our federal government. The census is Oakland Together.
The Oakland County Megacast on Civic Center TV and Birmingham Area Municipal Access Television, and our family of radio stations, WAHS 89.5 Avondale Community Radio, 88.1 WBFH, The Biff, and our flagship station here, 89.3 Lakes FM, live streaming online on lakesfm.com. We're also joined via Facebook Live today by the Greater West Bloomfield Chamber of Commerce, and like many chambers in our local area, they are doing a lot of work to partner with our local businesses, provide education and other programs to keep our small business community in Oakland County alive. And we have another great partner from a neighboring Chamber of Commerce to the Greater West Bloomfield Chamber. Joe Bauman, the president of the Birmingham-Bloomfield Chamber of Commerce, joins us again. Joe, welcome to the Megacast.
Thank you so much. Thanks for having me.
Absolutely. Thank you for being with us. Since we last spoke, a lot has changed. How are Birmingham and Bloomfield's businesses doing right now?
Well, a lot has changed, but a lot has stayed the same. As you know, the governor extended her executive order yesterday to stay at home until the 28th of May, which means that non-essential businesses have to remain closed. So for many of our members, our retailers, our restaurants, they're still not able to re-engage in a full capacity. So that continues to be a challenge. However, on the brighter side, there are some industries that are now back to work. The real estate community got to go back to work. The manufacturing industry gets to go back on Monday. Home construction is back up and running. So we're starting to see signs of life. But for the most part, in terms of Main Street retail, downtowns, they still remain for the most part closed through the rest of May.
Recently, Brian Calley, former lieutenant governor and the president of the Small Business Association of Michigan, held a Q&A with Bridge Michigan about the survival of small businesses. What are your thoughts on the best way for small businesses in your area and throughout Oakland County to survive as we continue to go forward in this process?
Well, I think that the key is to adapt to the new normal and come up with different sales strategies, coming up really with a different business model. This virus is going to be with us for a long time. And so retail outlets are going to have to rely more on online sales for sure. Curbside pickup, communicating with your customers is going to be critical. Everybody maintains a CRM of their best customers, and just making sure that you let your customers know what's available, what's not, how it's available, how it can be accessed is going to be really important.
In that same article with Bridge Michigan, with the former Lieutenant Governor Brian Calley, the current president of the Small Business Association of Michigan, it was projected that 1 in 7 small businesses in Michigan will survive this, and that the other 6 are going to have some serious issues and possibly close. Joe Bauman, president of Birmingham-Bloomfield's Chamber of Commerce, do you believe that is the case in your coverage area?
Well, I certainly hope not. I did see that report. We have been in regular contact with SBAM to talk about these things and also talk about reopening issues. There's no question about it that if companies aren't able to reestablish their relationships with their customer base, they're going to have real problems. We're particularly concerned about the restaurant industry. As you know, restaurants operate on a very thin margin to begin with. And if they're faced with only being able to have 50% capacity maximum, you're cutting their customer base in half. And we also know that those restaurants that serve liquor, the profit is really in the liquor. So if you are reducing customer base by 50%, you're still going to have almost all of your same expense though, because you still have to have a kitchen staff, you still have to have a wait staff, you still have to pay your mortgage and your utilities. So I think restaurants are going to continue to be probably, if not the most, one of the most vulnerable sectors going forward.
Has the ability to have curbside and delivery increasing as this process has gone on been an aid to restaurants especially, but also to other small businesses like retail in Birmingham and Bloomfield?
I think the results have been mixed. I think for soft goods retail, it's not been as successful as for restaurants. And that's why you'll see that in downtown Birmingham, for instance, the majority of the businesses are closed. They're not trying to do something with curbside or out the back door or whatever. their model doesn't work for that. With restaurants, I think they're doing it as much to keep a visible presence in the community and to make sure that their customers don't forget about them. I think restaurants that had a large carryout business to start with prior to the pandemic are doing better than ones, let's say, fine dining, because it's very difficult to try to maintain fine dining quality and price, frankly, when somebody's picking it up in styrofoam and taking it home. So I think restaurants are being as creative as they can be. They've expanded. In some ways, they've limited their menus, but in other ways, they've expanded their stuff. They're doing family meals, which have proven to be successful. Some are selling groceries, which they weren't able to do before. But again, none of that really comes with alcohol sales, and especially for restaurants that are built around fine dining and serving alcohol and having a bar, they're the ones that are kind of being double whammy.
You project as the future for small businesses in Birmingham and Bloomfield as this crisis hopefully starts to wind down?
Well, I think it's no doubt going to be challenging. Businesses are going to have a rough year financially. It's whether they'll be able to adapt to a new business model and whether they'll be able to move forward, knowing what the challenges are. We're hopeful that people have really kind of taken stock of how much they miss their favorite restaurants and their favorite stores. And so we're encouraged by the fact, and the Chamber is going to be out in the forefront and leading really a renewed and rejuvenated effort for our Buy Local campaign. I think what you're going to see is that people are going to start supporting their local businesses that are closer to home and wanting to support those that they have an established relationship with. So I think, and people are going to be a little more understanding of costs as well. Restaurants across the board are, they're reporting that when they're doing the curbside delivery and they're doing the carryout, people have been very generous in supporting and tipping the staff because they know that they're struggling. And we think that's going to continue going forward. So we're optimistic that we will be able to rebuild some base for customers, and that the customers will respond to whatever new model is going to have to be adopted.
Education, partnership, and innovation have been critical for businesses throughout this process, and it's something that the Chambers of Commerce are often very much involved in normal times to help these businesses as they're growing. What has the Birmingham-Bloomfield Chamber of Commerce been doing as this pandemic has progressed to provide that extra innovation help and the educational help to these businesses so they can do their best and put their best foot forward to try to survive this time?
So the first thing that we're doing is we're trying to keep them as updated and informed as possible as to all of the county, state, and federal assistance programs that are being offered to small businesses, whether it's PPP loans on the federal side, whether it's tax incentives on the state side, whether it's Oakland County's Small Business Stabilization grant program that just wrapped up phase 2 yesterday. So we want to make sure they're aware of what's available to them so they can take advantage wherever they can. Secondly, while we can't have events in person right now, we have put together a robust calendar of virtual events and webinars based on best practices, based on where do you find PPE, how do you survive in a virtual world, how do you manage your staff remotely. We're really relying on our experts who are members of our chamber to provide these twice weekly webinars and providing as good of updated information as we can. Right now, our members, the small businesses, they want to know if they're missing out on any opportunity for some kind of financial assistance. They want to know what they're supposed to be doing when the time comes to reopen their business, both for their staff and their customers. And they want to know how to be more technologically savvy, understanding that more of the interaction with their customers is going to be virtual and building an online sales platform.
After all this is done, after all this pandemic crisis goes away, and we're months down the road, we're years down the road, how long do you project, do you believe in Birmingham and Bloomfield and beyond, it will take for our small businesses to recover from this?
Well, hey, that's a great question. I think it's going to depend on each individual business. I will say this, everyone is going to have a tough 2018 because we're going to be dealing with this. If you looked at, the governor yesterday released her 6-phase plan to recovery for the state and for business. And we're only in phase 3. And so we're going to continue to have constraints and restrictions as to how we can conduct business, how many people you're allowed to have in your business. So I think for all of 2020, it's going to be a tough year financially. Hopefully by 2021, there'll be effective treatment for the virus and or a vaccine. And that's going to be the game changer, right? Because then it's going to become a manageable disease like so many others that we deal with on a regular basis. But I think our small businesses are resilient and they're passionate about what they do, and they're going to do everything they can to stay in business. And so it's going to be organizations like the Chamber and, and government assistance that's going to be the bridge to help them return to some sense of fiscal normalcy in 2021.
Joe Bauman, the president of the Birmingham-Bloomfield Chamber of Commerce, with us on the Megacast. Joe, just a moment before we have to let you go. Anything else you'd like to say to our audience? Anything else we haven't touched on yet in this interview that you'd like to speak on?
Sure. So I know a lot of our small businesses did try to participate in the Oakland County Economic Development Small Business Stabilization Grant Program. The first phase of the program rolled out a couple of weeks ago and has already been funded. It started as a $3 million fund, which was a combination from the MEDC and the county. We just wrapped up phase 2 in terms of the grant cycle, and this time there was $12 million available for small business applications. And so those businesses that did not get funded in phase 1 were automatically put to the top of the list for phase 2. So if you are a small business owner, if you did apply for one of the county grants, know that it's still possible you're going to get a grant, and you should know within a week. So the fact that the county used some of their CARES Act funding for this small business stabilization program was really outstanding, because a lot of small businesses, they need help right now paying their bills until they can get some revenue coming back in the door. So hopefully by the end of next week, there's going to be about 500 additional small businesses in Oakland County that are going to receive direct financial support. So we're very encouraged by that.
Joe Bauman, president of the Birmingham-Bloomfield Chamber of Commerce, joining us via Zoom on the Megacast. Thank you very much for being with us.
Thanks for having me. Stay safe, stay strong.
You as well. Joe Bauman, the president of the Birmingham-Bloomfield Chamber of Commerce, with us on the Megacast on this nice Friday morning here in the Oakland County area. We'll return in just a couple of minutes with our last guest of the day, Julie Fracker, the director of communications at the Cranbrook Academy of Art and the Art Museum over at Cranbrook. That coming up on this next segment of the Megacast after a short break.
I know you're concerned about the coronavirus, and we're working hard to combat its spread and keep your family safe. But we need your help too. Wash your hands often with soap for at least 20 seconds. Avoid touching your face and cough into your sleeve. Replace handshakes with an elbow bump. Avoid large crowds or events, and if you're sick, stay home and call your health provider. Every one of us can make a difference limiting the virus's spread and keeping Michigan healthy.
Hi, I'm Dr. Jonae Khaldun. I'm the Chief Medical Executive for the Michigan Department of Health and Human Services. The people who are at highest risk of getting severely ill from COVID-19 are the elderly and those with chronic medical conditions. That includes people with heart disease, diabetes, COPD, or those who have compromised immune systems. People who are in those categories should right now be staying at home as much as possible and not going out if it is not essential. If you fit into one of those categories, those are the things you should do. And if you have a family member who fits into one of those categories, you should be checking in on them and making sure they are following those guidelines. There's something everyone can do to protect the community from COVID-19. Hi, I'm Dr. Jonay Caldoun. We know that COVID-19 is spreading rapidly across Michigan right now. The most important thing people can do to protect themselves is social distancing. That means unless you are a critical infrastructure worker or going out to get food or medicine for your home, you should be staying at home. Stay home, stay safe, save lives.
The Oakland County Megacast continues on 89.3 Lakes FM and lakesfm.com. On TV on Civic Center TV, Comcast Channel 15, AT&T Channel 99, and on the same channels in Birmingham, Bingham Farms, Beverly Hills, and the village of Franklin. From Birmingham Area Municipal Access. Our partnering radio stations, 88.1 WBFH, The Biff, in Bloomfield Hills, WAHS 89.5 Avondale Community Radio in Auburn Hills, a service of Avondale Schools, with leadership from great high school student Logan Pizzuro doing excellent work for us here every day, getting us on the air in the greater Auburn Hills area and allowing us to speak with a variety of guests from throughout Oakland County on WAHS in that community, providing a service through news to the community, covering the Avondale School District, and allowing us to speak with a variety of guests, including the Director of Communications at the Cranbrook Academy of Art and the Art Museum at Cranbrook, Julie Fracker, with us now on the Megacast. Julie, welcome to the program.
Hi, thanks for having me.
Thanks for coming on. Cranbrook has 3 schools. Julie deals with the Art Museum and the Master's Program for the Cranbrook Academy of Art. How are you, Julie? How's your team?
Good, good. You know, we're pivoting like everyone else right about now.
Yeah, everyone's doing something different and has to innovate, has to change what they're doing to stay alive and to stay productive during this. Cranbrook is providing resources for students and the general public with some online programming from my notes. What are some of those programs that Cranbrook is providing at this time?
Yeah, so we have a few different things. Through Cranbrook Art Museum, if you visit our website, we have photographed all of our exhibitions and we offer them now as a 3D tour. So it's a virtual tour. You can actually sort of walk through the exhibitions. You can click on the items within there and you can actually read more about all of the objects in each of the shows. We started doing this just coincidentally, really just a few months sort of before all of this hit. So it's just our last few exhibitions, but as luck would have it, the timing was terrific because it really allowed us to give people a chance to maybe see a show that they didn't get a chance to come to the museum and see. Our educators have worked really hard to also provide educator guides that complement those exhibitions. So if you have a young child, you can walk virtually through the exhibition, stop, look at some of the objects there, and then do an activity with them. So pattern making based on a Ruth Adler Schnee textile, things like that. So we're really trying to still stay connected to the community, provide them with a service, and it is something, as I think we'll see as things go on, that we'll continue to do this. So this is something that yes, we're doing now, but the response has been so positive, and not everybody can get to Bloomfield Hills. Not everybody can get to the museum. So people from around the world in the future will still be able to enjoy our shows this way. So we're learning as we're going. We're also providing a lot of activities for kids online. So on our website, cranbrookartmuseum.org, there's several different sections on there with daily activities. On Instagram, every Monday, we provide mini maker activities for families to do together. So it's all about, still keeping busy, but also teaching these kids at the same time about arts and culture. And then the other event that we have coming this weekend is our online studio event and gala. So what happened this year in the spring, our largest fundraiser of the year is an event that's called Studio. We've had it since 2009. It existed in other forms prior to that, and it helps fund scholarships for students at the Academy of Art, and it also helps to support educational programs at Cranbrook Art Museum. So when everything started happening with the pandemic, we really had to make a decision. We knew we weren't going to be able to meet in person, but this event really does provide very critical funding for our students. So we didn't want to just skip it. And it also allows our students the opportunity to sell a lot of their work. They can sell the work at the gala, and then we also have an event the day after the gala that's open to the general public called Open Studios, where the general public can wander the studios of the students at the Academy of Art and purchase work directly from them. So our team rallied. We set up a website through ClickBid. The website is studio.cranbrook.edu. You can visit that site starting tomorrow, Saturday at 9 a.m. And there are 1,000 original works of art created by the students at Cranbrook Academy of Art. And so this is a master's program. So these are master's students. And the general public, for the very first time, has the ability to purchase this work online. Typically, you'd have to come to the event, you'd have to come to the artist studios, work with them. So it's another model that's still providing critical funding for our students. They're struggling as much as everyone else right now. And so this will provide direct funding to those students through the purchase of their work. And then it will also help support the departments and the museum moving forward.
So a lot of this art, it's nearly 1,000 pieces of art in this art sale that's been student made. During this process, I would assume that the art studios have been closed with all the tools being very hands-on to be making these pieces of art. So have these students been making their works of art for this sale at home also?
Yeah, so some have, but a lot of the work was made in advance. So our program is it's a studio intensive 2-year program. So we closed mid-March, as with everyone else. We had to close our buildings. So a lot of the work was work that they had already been working on for the past year and a half. So they had it sort of ready to go. There is additional work that I think was created remotely as much as they could. But most of it, like I said, most of it was already done. And it's a really wide variety of work. So if you're into painting or the fiber arts or metalsmithing or 3D industrial furniture design, you won't see a sale like this, I think, just because of the nature of the Academy being so diverse, where you will have such a wide variety of objects to choose from. And we pulled it together quickly. We went to our students and said, we can do this, but do you have work? Do you have things to sell? Because we still want to give them that opportunity. And they rallied and they put together, they had work that existed, they made new work. And so we all worked together and got it up on the site quickly. And we thought, if we have a few hundred pieces to sell, that's great. That's a good service. It still will help them. And they came through with 1,000 pieces of work. Wow. So there is something for everyone and a wide range of price points. There's ceramic cups that might be $55. There's paintings that may run into the thousands, but there really is something on there for just about everybody.
Julie Fracker, Director of Communications at the Cranbrook Academy of Art and Art Museum. There's also the Master's Program, the Academy's Master's Program. I would assume, like many other educational programs during this time, has been impacted. Did that move entirely virtual? Was that a little bit of a hybrid program? How did that work as we went into this pandemic crisis?
Yeah, it did have to move. We did have to move virtual. Which is not ideal, of course, for a studio-based art program. So the hardest part was that for our master's students, we had to cancel their thesis exhibition, which is when they show their final work. So we're working with them now to get that up online virtually. So we will have a virtual exhibition, but that won't probably be live until the end of May, early June, because they're still working kind of remotely on their projects. We do hope next summer to be able to still have some kind of a physical exhibition for them. We're working through details on how that would work. But for the rest of the time, really it was, the artists and residents at Cranbrook really worked, they turned on a dime, and the students were tremendous, and they set up Zoom calls just like this. And they, instead of having visiting artists and speakers come in and talk to the students directly in the studios, they had these Zoom conferences. And typically that's not something we would do. We would bring somebody right to campus to talk with them, but it allowed them to really talk to a wide variety of thinkers and artists and collectors and curators that they may not have been able to travel to Cranbrook. And so again, it is kind of this hybrid that we're learning from. So, the plan for us hopefully is to go back to, full being on campus in the fall with, of course, safety modifications in place. But I think there's things we're learning from this process too, that we may still have some of these conversations for people that may not be able to travel to Cranbrook to speak with our students. Now that we've done it, we've seen how beneficial these conversations can be virtually. That will sort of be a supplement to things that we'll do going forward. So it's, it hasn't been ideal. It's of course not what you want for a studio-based art program, but I think everyone has really come together and really made it work.
In terms of your graduating students in your master program, it's a special time like it is when you're graduating high school, when you're finishing your undergrad and you graduate from college or from a trade school or from any sort of program like that. What is Cranbrook doing to honor its outgoing class?
Yep. So today would have actually been our commencement day, today at 2:00. So we actually have a special website that we built that is going to go live today at 2. It's sort of a surprise for them. And they know it's coming, but they don't know the content that's on the page. And we've been working really hard over the past few weeks with our alumni, with our artists in residence, with their individual studio council, which is like their student council, to build a set of videos, to confer degrees online, to do a whole host of special things. So everybody knows to check their email at 2:00 today, which they will do. They will get a message from us, and then we'll make the website go live that will have just all kinds of things honoring them and a whole bunch of surprises that will live on that site as well. And our artists in residence all came together and, they made something for them. So I do think, they are getting something today to honor it. The hope is next summer, we will have we're looking to have an alumni reunion if all goes as planned, June 20th and 21st. And that Sunday of that weekend, we do plan to have an actual in-person commencement for this class, to sort of make up for what they're missing out on. So they're getting sort of, again, this hybrid, right? They'll get this thing today that still recognizes them and appreciates them and commemorates the day, and they can share with friends and family and all of that. But we don't want that to be a complete substitute for that in-person event, because that is so important.
Yeah, absolutely. And it's good to know that there's a plan in place for honoring this outgoing class and doing that online for now and in person down the road. Julie Fracker, Director of Cranbrook Academy of Art and their Art Museum, thank you very much for being on with us today.
Thank you.
Absolutely. Julie Fracker from the Cranbrook Academy of Art and the Art Museum, one of their 3 schools over there at Cranbrook, joining us on the Megacast, as we've been joined by a great lineup of other guests today on the program, on our family of stations, on Civic Center TV, on Comcast Channel 15, AT&T Channel 99, and live streaming online on civiccentertv.com, a service of the Greater West Bloomfield Cable Communications Commission. Birmingham Area Municipal Access, also on Comcast 15 and AT&T 99 in Birmingham, Bingham Farms, Beverly Hills, and Franklin. And on our radio stations, 89.3 Lakes FM, a service of the Greater West Bloomfield Cable Communications Commission, 88.1 WBFH, The Biff, a service of the Bloomfield Hills School District under the leadership of Ron Whittables, and WAHS 89.5 Avondale Community Radio, a service of Avondale Schools, today under the engineering tutelage of Logan Pizzuro over there. And for all of us on our team, Jeff Cohen, our producer, our executive producer, our producer Larry Nyland, running our Zoom meeting, keeping that all up and running during the entirety of our show, getting our guests in, making sure they're comfortable and ready to go for us in here. Our team out in the field as well, Ryan out in the studio, editing our pieces together, getting the show ready for replay, getting those clips and interviews for you with the help, of course, of our great co-host over here, Erica Jones, in the studio with us, also getting those ready for you so that if you can't watch the whole show, you still get all that information you need. And for all of our team here, we thank you for tuning in this week. We will be back on Monday, 10 a.m. to 12 noon. In the meantime, it's a tough time for us. There's a lot of fighting going on. I urge you, our listeners, endure and let go, because we're going to get through this, and we'll get through it together. Thank you for joining in. That will do it for today's edition of the Megacast.